Sarah Thompson, a 35-year-old marketing executive, had always prided herself on her healthy lifestyle. She exercised regularly, maintained a balanced diet, and had no family history of diabetes. So, when she began waking up at night and going to the bathroom, her husband became suspicious. Husband thought she must be texting or calling somebody from the toilet. So, he silently went up to the bathroom door and listened. He could only hear the sound of water, no texting or talking sound. So, he decided to confront her directly. She never used to do that before. After a few minutes of arguments, they decided it was better to go and see a doctor. Concerned about her symptoms, they visited the family doctor. She explained the frequent urination, especially at night, especially during the last few months. After running some tests, the doctor delivered a surprising diagnosis: type 2 diabetes. Given Sarah's age and physical condition, the doctor assumed this was the most likely explanation for her symptoms. Sarah was prescribed metformin, a common medication for type 2 diabetes, and advised to make some dietary changes. Initially, her blood sugar levels seemed to improve slightly, which appeared to confirm the diagnosis. Despite following her treatment plan diligently, Sarah's condition began to deteriorate over the next few weeks. Her blood sugar levels became increasingly difficult to control, and she experienced rapid weight loss despite her best efforts to maintain a healthy diet. Frustrated and confused, Sarah sought a second opinion. The new endocrinologist listened carefully to her story and ordered additional tests, including antibody and C-peptide tests. That was a little bit uncommon test in type 2 diabetes. That test was not done initially. The results were eye-opening. Sarah's C-peptide levels were extremely low. The pancreas also makes C-peptide when it makes insulin. Measuring C-peptide gives a more accurate indication of her insulin production. The endocrinologist delivered a startling revelation: Sarah had been misdiagnosed. She had type 1 diabetes, not type 2. The endocrinologist ran some additional tests, including antibody tests, to confirm the diagnosis. The misdiagnosis had serious consequences. Sarah had gone months without proper insulin treatment, putting her at risk for diabetic ketoacidosis, DKA, a potentially life-threatening condition. Moreover, the delay in correct treatment accelerated the destruction of her vital organs like kidneys, heart, eyes, and nerves. With the correct diagnosis in hand, Sarah's treatment plan was completely overhauled. She was immediately started on insulin therapy and received comprehensive education on managing type 1 diabetes. She learned about carbohydrate counting, insulin dosing, and how to use continuous glucose monitoring technology. It was a really steep learning curve. Sarah's case serves as a stark reminder that type 1 diabetes can occur at any age, and that assumptions based on age or body type can lead to dangerous misdiagnoses. It highlights the importance of thorough testing, including antibody and C-peptide tests, in adults presenting with diabetes symptoms. A couple of other things to mention are: a person who originally receives a diagnosis of type 2 diabetes may still get a separate diagnosis of type 1 at a later date. Type 1 diabetes most often develops when a person is younger, although it can occur at any age. Also, people with type 1 diabetes can have insulin resistance. Insulin resistance is the situation where the body's cells don't respond properly to insulin. People with type 1 diabetes who are insulin resistant require higher doses of insulin to manage their blood sugar. On the other hand, by minimizing insulin resistance, people with type 1 diabetes can reduce the dosage of insulin required. Today, Sarah is thriving with proper management of her type 1 diabetes. She has become an advocate for diabetes awareness, sharing her story to help others avoid similar misdiagnoses. Her experience underscores the critical importance of accurate diagnosis in ensuring proper treatment and preventing potentially life-threatening complications in diabetes care.